So the most important thing about a habit comes because a habit is formed from the memory. You have to have a memory system. If you remember thing, then you will have habit, correct? That's non-declarative memory. The declarative memory is usually conscious. The non-declarative, which is implicit memory, is mostly unconscious. I said mostly. So when you see procedural memory, that's skill, motor skill, is a habit. Okay, it can leave either from the frontal lobe or other areas of the brain, and that makes addicting as well as habit forming because you enjoy so much and there's nothing to stop it. So at least you have an idea why internet games are so addicting because of this phenomenon. That in fact the games are made that way that the slides keeps on changing quickly and you have full control on it rather than the slow moving one. The slow moving one, you lose interest. The fast moving games, planes, automobiles, and all those things, you kept the interest alive because there's so much activity going on. So you enjoy it as if you are in that thing where you're driving or flying, right? So that is one of the reason why it's so addicting internet behavior is because of unpredictable, and it's sometimes you are seeking, it's just like a gambling thing, like you feel like you may win, now you can win, or now you can win, or then suddenly you win a little bit. So it's a gambling type habit, correct? So that is why you get more addiction behavior from that. Let's go to the next slide. Okay, so now coming back over here, as I asked you this question, and everybody may have a different answer. So, in my opinion, and this is my opinion, is Wallahu alam, Allah knows the best. I definitely feel the nafs is one of the center, and on the extreme right, you have operant condition, the reward and punishment, and a classical conditioning. These are also the two major things that affects your habit, because basically when you have a reward phenomena that excites the akal, the thinking portion, but if you have the hikmat, then the akal will tone down, correct? And it will how you change your habit, that's your question. You have to spend time on yourself to figure out what are your habits are. Are they constructive or are they destructive? That's your first process, correct? How much time you're spending and what are the habits. Once you identify that is not helpful, then you think about how I'm going to fix the problem, correct? Is it based on the Holy Quran and the Sirah? Yes or no? First of all, you have to answer that. If it's not, then why are you doing it? When it's not, and you're wasting your time on this, why is your reward phenomena is pushing you in that direction? Correct? You have to think about your biases, fallacies, and cognitive dissonance that is pushing your nerves to do that. Correct? So you need to fix your biases, fallacies, and cognitive dissonance as well as your ego conflicts. When you correct that, your nerves will fight against you because nerves enjoys what you are doing now, correct? And it does not want to cut down on the habit of what they are enjoying it, correct? So you need to go back to Quran and the Sirah to understand why Huzur Sallam used to spend most of the time doing good thing. Always wait for the namaz to happen. Why the Sahaba used to do that? Why the Sahaba don't waste time? The reason why they don't waste time because they knew that every second they will be asked in the next life. You have taken an oath, correct? In Alame Arwa. You have solemnly oath that I will follow the Quran, correct? And the Sirah in front of everybody, correct? You're giving the time, Allah is giving you time to test it. Okay? Time is open for you. There's no limitation. But once the time is over, everything is over. You will not be given 1 second more. In fact, in the next life, you will beg Allah. we all will be begging Allah to send us back again so we can do something better. You need to understand that part. That's coming from.
Yes, you can stop now.
Assalamu alaikum. Can you hear properly?
Walaikum
Yes.
assalam. Yes.
Walaikum.
Thank you very much for. My name is Dr. Najeeb Ranginwala. Thank you very much for coming. First of all, I am thankful for Allah for allowing me opportunity to present. Everybody can say Durood Sharif. Recite Durood Sharif. Assalamu alaikum, everyone. Thanks. It's a good crowd. I can see that. So, my name is Dr. Najeeb Ranginwala, IMS UK, to invite me. This is a very interesting topic. And I have presented, I think, 4 presentation. This will be a build-up presentation based on the first 4. So, this will be my 5th presentation. The first presentation was actually before that. I'm thankful for all of you of coming here, all the spending time. I know you're busy and all those things, but beside that, you came in and interested to learn. That's speak highly of you, and hopefully we will continue doing that. So in my first presentation, I talk about self-esteem. I brought the concept of psychology with Islam. Islam is the ideal religion, but we want to understand more about Islam. So we look up from psychology to make a better understanding of Islam. So I went into minor detail about that, the flaws in our thought process, in the definition of self-esteem that we have struggled. So then why don't we come with a higher self-esteem? So I went into that detail. Then the second presentation was role of the qalb, ruh, and nafs with the self-esteem. I went into minor detail about that. That how these ones, which are mentioned in the Quran, make sense. And if you apply the psychology concept, it will be very helpful. Then the other 2 one, which was the dynamic paradigm of the soul in high self-esteem and neuroadaptive paradigm of the soul in high self-esteem. So these are the further going up to using the concept of akal, ilm, hikmat, and all the ego complex and how it affects your self-esteem. So basically cover everything. So at least you have idea from the Islamic concept and from psychology concept, how you're going to fix the issue. Everybody has some issues, and including me too. We are not above the law, so we also have issues, and we can, if you're cognizant about it, you will want to fix it. If you're not cognizant about it, it will be difficult for you to fix it. So that's the reason. Anyhow, so today we are going to go into the concept of internet using habits, correct? Behavior insight and remedial strategies, correct? So internet we are using, Miss Major, I think so everybody who's listening to that is using internet. In fact, it will be hard to say somebody is not using internet listening to this presentation. So the key word is habit, correct? If you look at to that, and let's look into this concept of habit. How do I apply this concept? So let's go into the second slide. I want you to go. So this is a second slide, which is a flow chart. I want, it means I basically want you to pick 2 boxes where this habit principally apply. That's very important to understand because this is coming from the Quran, correct? Most of the things are coming from the Quran and the behavior science. So I need you to put that thought process into mind where your habit falls into this. If you identify correctly, that will help you to fix the problem from the basics from Quran and from the basis from psychology concept, right? If you don't identify correctly, you may come across, but you will take a longer time. Does anybody wants to answer this question?
I think this is nafs and qalb.
Nafs. Nafs and qalb. Okay. Anybody else? You can pick the same answer. Wallahu alam, Allah knows the best, by the way. But in my view, I will tell you later. So then you can really understand the concept, correct? And not everybody means there's no perfect answer. The perfect answer, Allah has it, correct? Wallahu alam. But from the base, from psychology and psychiatry, I can pick up the two best choice, and you may be perfectly right in your selection. Anybody else wants to go and answer this question? Okay, so please do answer this question, and you should have a reason behind that. So then you can autocorrect yourself, right? And I'm pretty sure everybody may have a good reason why they're selecting it, correct? So just keep in mind, write that thing, and then we will go into detail why we selected that, correct? So let's go to the next slide. So the most important thing about a habit comes because a habit is formed from the memory. You have to have a memory system. If you remember thing, then you will have habit, correct? That's a fundamental rule, correct? Without memory, you won't have a habit, correct? So I just want to go with you a process where you understand better, correct? As we have discussed in our previous presentation that in our mind, we have a conscious and unconscious mind, correct? And 60 to 80% of the information is sitting in unconscious mind, okay? So there are memory portion which is sitting in unconscious mind, as well as memory portion sitting in the conscious mind, correct? So we need to understand that thing because you can correct your conscious mind and conscious habits, but the unconscious mind, unconscious habit cannot be corrected unless you look into it. So that's why I brought up this slide. We'll go from there. Okay, we can go to the next slide. This slide we already presented, and it went into detail. This Amsterdam Symposium showing that how much conscious and unconscious minds contribute to our thinking process. So if you look at happiness, anger, fear, and sadness, you will see the unconscious mind have a significant effect on your thinking process. So then your habit is coming from there too, correct? And just want you to be aware of it before you start correcting the habits. We can go to the next slide. This is just showing your brain, and if you can see in the middle, we have the hippocampal area where memory store. Most of the memory is stored over there, as well as memory store in other areas of the brain. This is the actual brain of the human body dissected. On the left side is your frontal lobe, which is where you do sijda, and on the back side is occipital lobe. So this is just a section of the brain showing it. We can go to the next slide. So this is, we have to analyze where the memory system is and where the habits are coming. So if you look into detail, you have a memory of a long-term and a short-term memory, correct? So in the long-term memory, you have declarative and non-declarative memory. The declarative memory is usually conscious. The non-declarative, which is implicit memory, is mostly unconscious. I said mostly. So when you see procedural memory, that's skill, motor skill, is a habit. Okay, classical conditioning, conditioned response between the two stimuli, that's become a habit. Non-associative learning, habitual thing. So these are sitting there in your unconscious mind, which become your habit. So do you understand why I was talking about conscious and unconscious mind and where is the memory is? Your habit is all associated with memory, and where is the memory is stored? You need to understand these are the process in an unconscious mind. We can go to the next slide. These are the location of the exact location where your memory is stored. So you can see procedure memory stored in the basal ganglia, and then you have a procedure memory in the cerebellum store, as well as, this is the subconscious mind. In the conscious mind, also some portion of the memory and habits are stored, which is mentioned here. So at least you know where the memory is stored and where the habits are sitting there in your brain or in your mind, correct? Just want you to be aware of it. Let's go to the next slide. This is significantly important slide. We need to go in detail about this slide because it shows a portion of your brain how it works, correct? So you have the frontal lobe just behind where you do sajda. This is where the executive decision making place. And then you have the hippocampal area where the memory is stored. You have the amygdala and all those things. Let me enlarge the slide more better. Yeah, that's fine.
Sir, it's so much blurred, we cannot even read.
Okay. Okay, that's fine. Let's go to the next slide. This is better.
Yeah, this is
Okay,
Yes.
better.
good. So now you can see these are the different areas of the brain, correct? So you have the VTA, ventral tegmental area, where the dopamine is produced, correct? And that gives the pathway track of the dopamine mesolimbic pathway. It affects your reward center and the punishment center. Keep in mind, reward and punishment both are stimulated by the dopamine, by mesolimbic system. Now, the reward center is the nucleus accumbens. This is one of the reward center, major reward center. The punishment center will be amygdala, where the fear and all those worries are. So these are all stimulated by the VTA from the dopamine pathway. So just keep in mind that when the dopamine uh, is released, it can release on both of them at the same time because you are in the dynamic state of mind, correct? Not just one is released, one area is released, both areas are released. And the other thing you have to, which is the short loop. The long loop, which is the frontal lobe, prefrontal cortex, where executive decision taking place, which is in the pink color, that is also connected with you, correct? So when that is connected with you, you need to understand much better how I can, go from there, that how the prefrontal cortex connect back to you and explain back to you. So, the prefrontal cortex also receive information from the reward and punishment and it gives you back. Okay, so this is a complicated pathway, but this is how your brain works. So when your brain is stimulated by the reward center, the other centers are also stimulated, not just one center, correct? And this is how, so these are the habits formed. You have to understand when you're forming a habit or you're following the habit, different areas of the brain are stimulated at the same time, not just one area. So you just keep this thing in mind. Okay, let's do the next slide. Going back over here, you can see the whole center of the system, how it works.
The
I'd
last
like to
slide has been
enlarge this
skipped.
thing.
Sir, this slide has been skipped.
So,
Okay, go back. Okay,
do you mean
yes.
this one?
Yes,
Okay.
this one. So this is the insula or the pleasure center of your brain, correct? So this is where your pleasure center is located, along with other centers of the brain. The orbitofrontal cortex, which is at the base of it, that's also contribute from the frontal lobe, correct? So you have a reward center sitting over there at different areas and they get stimulated. In the meantime, you have a punishment center that is also get activated, depends on how much need it is there, as well as your frontal lobe is working, executive decision is made. So there are different pathways are involved. So you always remember when you're doing a habit, different areas of the brains are involved, different neurotransmitters are produced. Dopamine is one of the major transmitter, but dopamine is also controlled by different neurotransmitter, which I will go into detail. So when we talk about dopamine, that's a tip of an iceberg. But that's not all the information. You need to know what other neurotransmitter are affecting the dopamine to create that habit. And that is the full story. Unless we don't understand that, you will miss the story. Why are you doing this habit? Because you just focus on dopamine, but there are other neurotransmitter involved in it. So keep this thing in mind. Let's go to the next slide. This is the pathway, neurological pathway explaining that, you can see the ventral tegmental area where the dopamine is produced. It goes to nucleus accumbens, which is one of the reward center, and it also goes to amygdala, which is a fear center. Then you can see the prefrontal cortex that is also contributing back to the amygdala nucleus accumbens. Now you can see the neural pathways are glutamates or what GABA is used. And other neurotransmitters are used, correct? So we have a complex system how it works. It's just not dopamine and then pleasure pathways are involved. There are other pathways in the brain involved, and is the combination of that creates your habit or why you follow the habit or why you don't want to do the habit at that time, correct? It auto corrects you. So just keep in mind this is what is very important. I'm just building up the story, then I will go to internet because first we have to understand how we develop habits and why we do habits. Once we establish that, then we can fix the issue. Okay, let's go to the next slide. This is another way of showing the pathway. You can see all the neurotransmitter as well as different medications affecting different location of the brain. So you can see the red area. This is VTA, ventral tegmental area. The blue one is the nucleus accumbens, which is also the reward center. The amygdala, AMYG is amygdala. This is the fear center, and the green one is the frontal lobe. Now you can see all different neurotransmitters are produced affecting each other. So no, so you have to understand the GABA is affected, the glutamate is there, the dopamine is there, norepinephrine is there, and all the neurotransmitter affecting that. So it's just not dopamine always, correct? So I just want you to be aware when we develop habits, this is both pathways are there. The whole collective brain system is working to develop a pathway. Hopefully makes sense to you. Let's go to the next slide. This is another way of showing how different areas of the brain are involved in forming a habit. So you have a reward pathway, you have a punishment pathway, you have an overlapping pathway, and no feedback pathway. So it's not just one pathway working. This is from the, if you want to read more about it, you can pull up this. It's a very detailed discussion on this paper, but at least you get the point across that different areas of the brain involved, different neurotransmitters are involved. Yes, dopamine is one significant neurotransmitter, but it's not the only neurotransmitter. Okay, next, let's go to the next slide. This is just like if you have motivation and pleasure, you can see at the bottom that you have GABA, glutamate, dopamine, and oxytocin are involved. And these are different centers where they are connected in a loop form. So at least you have an idea that PFT is prefrontal cortex, correct? Amygdala is AMYG is amygdala, which is a fear center. HIPP is hippocampus, where the memory is stored. Hypothalamus, and then nucleus accumbens, NAC is nucleus accumbens, that's a reward center, right? And so these are all centers are connected. So just keep in mind the habit is formed by different centers combining together to get the effect, not just one pleasure pathway. Okay, just want to keep in mind. Okay, can we go to the next slide? This is just explaining the system that you have brainstem where VTN is there, mesolimbic pathway, which connected to both reward and punishment. Reward and punishment is connected to each other as well as prefrontal cortex. So you make a thinking behind that also. There are times when you are thinking from your unconscious mind, it goes much faster and you don't think about it because it's from the unconscious mind. From the conscious mind, you can auto-correct yourself, correct? So you just keep in mind everything is connected, okay? But it's important to understand where your habits are coming. Most of them are coming from unconscious mind. And then you do it very quickly because you plan to do it until unless you start spending more time to think about it, to change your habit by using prefrontal cortex to auto-correct it, just to make things very simple. Let's go to the next slide. So these are the different neurotransmitters. This is just a few of the neurotransmitters I'm saying that. So when you are using the internet, for instance, and you feel pleasure, correct? Then also the other neurotransmitter are used. You know, your serotonin is used, and which is basically the happy mood or the mood symptoms. Your non-adrenaline is used for concentration, correct? Glutamate is used for memory system. If you are calm, then GABA is used. For learning, acetylcholine is used. For oxytocin bonding and empathy is used, correct? So there are different neurotransmitters produced. I just want to make you understand. Just don't stick on dopamine all the time, correct? These all neurotransmitters affect each other. Let's go to the next. This is going further in detail of each reward and punishment and what are they connected to. So at least you have an idea that different neurotransmitters are used and they're connected to different areas of the brain. So we can go to the next slide. Okay, this is a very important point to understand. When you increase the serotonin, which is 5-HT, your dopamine and norepinephrine increase, which is, the pleasure and concentration, but acetylcholine goes down, which is a learning thing, correct? But it is not straightforward. If you increase significant amount of serotonin, the dopamine will go down. So it's not a straight pathway that if you increase, the other will increase. So you have to keep, there's a hemostasis formula in your body. So just not increasing all the way up, everything will go up. No, in fact, the dopamine will go down if you have significant amount of increase of serotonin. So when people who are depressed, like if you look at the level of serotonin, which is low, but if you increase their level of serotonin very high, they become isolated and apathy develop, which looks similar to depressed. So you have to develop pathway or the hemostasis system in your brain where all the neurotransmitter is at the hemostatic level, not too high, not too low, and they are all connected to each other. Just want you to understand in the limbic system is a complex pathway, just to have an idea behind that. That's why when we use medication for depression, you have uh, two neurotransmitter, three neurotransmitter, tricyclics, and all those things are used because initially we start on SSRI, but if it's not helping, we use SNRI, DNRI, and all those other medications just to make sure that other neurotransmitters also are in homeostasis with them. So it's very important to understand that. Okay, let's go to the next slide. This is the brain showing the very important connection, and you can see the GABA, glutamate, dopamine, peptidogenic, and serotonin are connected to each other, which came in the scientific journal. So this is how you are connected in your brain, correct? These are the centers, all are connected, not just one center works, just to make you aware of that. Let's go to the next slide. This is how your addiction develops. So you have an impulsive drive and a compulsive drive, and that motivates you to go into that direction. This is for alcohol only, correct? I'm just right now talking about alcohol. This is related to alcohol, but I will come back to internet, and that's a very important topic. So you have the impulsive drive and compulsive drive, and these both works to go into addiction because you have a drive and then different neurotransmitter going in that direction. And so it tells you a very nice way how this drive push you to that direction. But this is just for alcohol only. Okay, let's go to the next slide. But it's helpful to understand that how we develop addiction. This is another way of showing how other neurotransmitters are involved in these pathway, so at least you have an idea that different neurotransmitters are involved. So we can go to the next slide. These slides take so much time to explain. And it's at higher level, so that's why I'm not explaining in minor detail. This slide actually explains that your hemostatic point changes from that to allostatic state. So when you're dependent on alcohol or other habit, you can see your allostatic point keeps on dropping down. So you're off from the usual hemostasis. So you need to have a hemostasis going on. If you are not in homeostasis, how things goes down the hill. So just giving the slide presentation how it goes down the hill, and you are difficult to catch up as your system keeps on changing to a new paradigm. Let's go to the next slide. And this is just a connection showing from the anatomy how the VTN, which is where the dopamine is produced and stimulates the nucleus accumbens, which is, and it shows in the red that that's how it's connected. So these are just a neural pathway connecting that. So I just want to show you this is how actual pathways in the brain is. Let's go to the next slide. This is also from the amygdala. So there's a fear factor from the voice and the voice in the face, the amygdala lit up so much. So it tells you exactly how this center respond to fear or punishment, correct? And this is the pathway showing that. So just want you to acknowledge that from that. Okay, let's go to the next slide. So now this is one concept you need to understand. So when we hear something or when we want to hear it, this is the pathways goes in from the ear to your brain, correct? So you can see the cochlear nerve, which is the vestibulocochlear nerve, which is the atrial nerve. It goes to the lateral lemniscus to the medial geniculate body or nucleus, which is in the thalamus, and then it goes to the cortex. So then you can hear the voice which you are hearing is coming this pathway, correct? So you understand that when you, as you're listening to me, this is the pathway it's going through it. Just want to make you clear that this pathway does not goes to the brain first. It pathway goes to your this pathway does not goes to your heart first, correct? It goes straight to your cortex where your voice is identified. We think about it, what the voice is. So when we read Quran or anything, our brain or mind listen to it, identify it, and then the effect goes, and then it goes to your heart. This is the pathway. So just to be very clear that when we hear, it does not goes to your heart, it goes to your mind or brain, and these are the pathways. Just want to be very clear on that. Okay. And then when your habit develop based on that, what you hear, what you understand, you do that, correct? Let's go to the next slide. So now this is how the effect of dopamine is for different thing which we do. So like food, very fatty food or something like a lot of starch in it, it goes up. The video game goes 175%, and then as the drugs and all the other activities, it keeps on going higher and higher. The important thing you need to understand, and this is very important to understand, the video game which is saying 175, this is for a regular one. Now you can have a much higher level depending on what type of video games are you watching. Because basically how it works is that when you are in a frame where the video games are changing, you are excited. When you're excited, yeah, of course, the dopamine will keep on going up and up because you are enjoying it and it keeps on changing and you have a full control on it. When you have a full control and a pleasure on it, and you feel you are sink into the video game, the dopamine is much higher. So it's going so fast that your system, which is from the frontal lobe or from the other area of the brain, cannot catch up to control it, correct? You are going significant, so the GABA, glutamate, and all those other neurotransmitters are there, but they cannot catch up because you're going so fast. So the binding of the dopamine and goes so fast and you're enjoying it, you go into that pathway. And that is one of the reason why internet, when you're using game, it's become very addicting. Actually, in psychiatry, we have not used the word addicting. It's been actually they're looking into the data to classify whether it's addiction or not. But based on the way things are going, I will be not surprised it will be considered addiction. But this is a reason why it is because of the certain search and you keep on doing it, so you enjoy it, and nothing is stopping it significantly, either from the frontal lobe or other areas of the brain. And that makes addicting as well as habit forming because you enjoy so much and there's nothing to stop it. So at least you have an idea why internet games are so addicting because of this phenomenon. That in fact the games are made that way, that the slides keeps on changing quickly and you have full control on it, rather than the slow moving one. The slow moving one, you lose interest. The fast moving games, planes, automobiles, and all those things, you kept the interest alive because there's so much activity going on, so you enjoy it as if you are in that thing where you're driving or flying, right? So that is one of the reason why it's so addicting. Internet behavior is because of unpredictable, and it's sometimes you are seeking, it's just like a gambling thing, like you feel like you may win, now you can win, or now you can win, or then suddenly you win a little bit. So it's a gambling type habit, correct? So that is why you get more addiction behavior from that. Let's go to the next slide. Okay, so now coming back over here, as I asked you this question, and everybody may have a different answer. So, in my opinion, and this is my opinion, is Wallahu alam, Allah knows the best. I definitely feel the nafs is one of the center, and on the extreme right, you have operant condition, the reward and punishment, and a classical conditioning. These are also the two major things that affects your habit, because basically when you have a reward phenomena, that excites the akal, the thinking portion. But if you have the hikmat, then the akal will tone down, correct? And it will make you realize it that you're going to follow the Ru concept or the superego concept to make sure that you are in the right guideline of your qalb, to the qalb salim, correct? In the other hand, your nafs, which really enjoys the video games or internet habits, have a great pleasure. So if your Ru is not controlling your qalb and your akal is not guiding you through that pathway, the nafs control your qalb. When the nafs control the qalb, you're going towards nafs amara, especially if you're doing video game and wasting your time and all those things. So you will go to qalb mayyat or qalb murid, correct? This is your qalb goes it, correct? You form a habit because you enjoying it, correct? But not realizing that you are wasting your time, correct? Because time is very precious. Your time is not free. Your ear is not free. I am telling you, if you read Quran, you will get it. It's given almost as it feels to you it's free, but it's not, because you're accountable. You are accountable. In the next life, you will be asked every second, what did you do? So it's not free. We pretend it's free because we are in control of it. That's why we do that. So it's very important to understand that Allah has given you the right to do whatever you want because you are accountable. If you are accountable, so you need to understand. So you develop habit based on that, on your accountability. So when you develop based on accountability, you need to understand what your rule or your fitrat is, and you use your akal to make your qalb towards qalb salim, correct? And you use your hikmat. When you do that, you will work on your habits, correct? You will work what is correct habit, what is a bad habit. You will control your reward and punishment pathway. You will control your classical conditioning, which is pairing. Or you will also correct your alternate thoughts, which are biases, fallacies, and cognitive dissonance. You will also correct your ego conflict, correct? When all these are corrected, your nafs will go to nafs mutmainna, right? That's why I'm telling you why this flow chart is very important, right? Hopefully makes sense. And remember, it's also in the conscious and unconscious mind, so you need to think about it. Now, moving forward, let's look at what happens to our kid when they use internet. So let's go to the next slide. Just giving you an idea, this is how your neurons works, correct? So basically, when you're born, you have tons of neurons there, and they keep on cutting down because you don't need it. So you can see the synaptic formation is the highest when you're born. By the age of 4, there's synaptic pruning that they start cutting it because you don't need it. So if you're born in Japan, or if you're born in Korea, if you're born in somewhere else, you will learn that language. You listen and you learn that language because your neurons are set to learn the thing. But if those neurons are not using it, they snaps because it's no use for them. It's too much weight to carry. So this is auto system in your brain to cut down the number of neurons if you don't use it. So it's ideal time to learn language at the earlier age. That's why, because you hear the sound, you reproduce the sound, so you have the neurons keep on building up with the synapses and all those things. So it's much easier to learn the language when you are at an earlier age. You can learn later also, but it's easier because the system is made that way. So at least you have an idea behind that, correct? So now we are going, I will establish why this is important for you, correct? So let's go to the next slide.
Sir, can I ask a question?
Quick one, go ahead.
Okay, so if that means in the previous slide you have shown that we have kid has so many neurons. That means if like he is capable of learning more than one language at the same time, and if it doesn't, then the other neurons discarded because the kid don't need it.
Correct. Because neurons have like you learn Urdu, you learn English, you learn German, and things like that. The neuron will keep on catching up, correct? Based on that. Any neuron which is not used, they will start cutting it, snapping it, because it's not more used, correct? So you learn languages, you have a system of learning language. You have a system, you have a pathway. The more you use, the more is used, utilized, and you preserve it. The less you use, it does not need it. So you start cutting it off. So that's why it's easy to learn language at early because you have a shrinkage of neurons taking place. So you will see the kid learns much faster. Synapses are formed much faster when they learn. So this is a process going in your brain, as you will see that. But it's a good question. Let's go to the
Thank
next
you.
slide. This is how the development of the brain take place. So you see the myelination. The myelination is the fatty tissue oligodendroids, which is surrounds the neurons that keeps the pathway much faster, is highest when you're born with it. And then you can see the pink line going down. So this myelination is being completed. So myelination is complete by the age of 22 to 24, varies from place to place, correct? But usually around that age time, the myelination is completed. But the maximum myelination is going when you're born, because they are trying to myelinate because these neurons are open, most of them, and new neurons are being there. So they are myelinating it, as well as what is not used, they are taking it away. So you can see that this is how the pathway is. So in adolescent, you can see the myelination has a lot of myelination has taken place. You have synaptic refining is also taking place. So whatever you needed, they refine themselves. Your brain is changing as it needed. And it's a very important slide to understand. Why so important? Because if you use internet services when you are 3 years or 4 years old, how the system is working? It's immature right now, correct? It's not mature. It has has the frontal lobe has not kicked in, correct? Now you're learning from the limbic system, enjoyment pathway, this and that. So you're not learning the correct way it should be learned. You're sitting on the table and learning just from the internet and all those things, not physical activities or thinking of using the frontal lobe to think, make a judgment, executive decision making is not there, correct? And your mind is very immature at that time. So what's your habit develop? Same way, what you learn, correct? So it's very important how much time you're spending on those equipments. It's very important to understand that. You have to use all your senses. You have to write, read, read the books, things like that, and be practical outside. Go outside, have physical activity. Physical activity has significant effect on your brain. It's regenerate much faster. It grows fast because your brain is growing, correct? Physical activity increases your growth hormone, the other hormones are produced, correct? And then it helps your brain develop properly, correct? If you are not doing that, you're shrinking the amount which should not be done, correct? So when people are using internet and things like games like that, most of the time they are not doing favor to their body, correct? Especially their brain. Yes, you can use internet, but as appropriate amount, correct? Not long time throughout the day and all those things. So do you understand from this graph how much important it is that if you get the kid become the internet their babysitter, how much destructive it is? So I just want you to make understand this is a very important slide for you to understand. Let's go to the next one. Okay, so this is another slide showing that as you are growing up, your limbic system is the one that controls, and prefrontal cortex is behind because it's not completely myelinated. But by the age of means 20 or 24, the prefrontal cortex or executive decision taking place. Now, all the habits or your habit can have influence from the frontal lobe, correct? So when you do bad habits and you spend time to think about it, frontal lobe will kick in, correct? If you are at an earlier age, the limbic system is running the show. And this shows you how your brain is working. Okay, let's go to the next slide. This is another slide showing that when you're a child, your striatum, which is a limbic area, that is very active, not the prefrontal cortex. At the adolescent, both are equally contributing. But when you are adult, the prefrontal cortex or executive decision making, the frontal lobe where you do sajda, is the one who makes the most of the decision. So it's very important to understand that prefrontal cortex develop later. You need to spend time not to do all those activity when your limbic system is activated all the time, because you learn the behavior based on your limbic system, then it stays with you. It will be take time to take it off, correct? So use appropriately internet or gaming devices, because how you learn at what time, correct? So it's very important. Let's go to the next slide. This is how the myelination of the brain is taking place. As you can see, at the age of 20, it's more myelinated as compared to the age when it's 5. So just giving you idea how the myelination is. Let's go to the next slide. And this is another way of showing it, the myelination of the brain as it grows up, okay, in a kid. Let's go to the next slide. Okay, so Jean Piaget developed this cognitive development. Very important to understand, because this is where you need to understand how kids get affected by internet or gaming devices. So basically, his way of thinking is schema simulation accommodation. That's the basic concept how cognitive development in a human being take place. So I will go through this process quickly. So the first 2 years of life, you acquire language. As I mentioned to you, while your neurons are cutting, so you learn language in the first 2 years or first 4 years, six, because it's a very good time to learn language, correct? Then your mind goes into the symbolic reasoning. That is significantly important. Why? Because empathy develops at the end of the symbolic reasoning, correct? Symbolic reasoning means you identify with the symbols. You combine the symbol together to make think work. You have a symbolic reasoning. When everybody has, first you have to remember what is a symbolic means. You identify, try to find the meaning behind that. And that is the time when your empathy is also developing. When the child is born, he has narcissism. Everything belongs to them, correct? By the age of 6, they need to learn that the child has to learn that they have a father and a mother, they have the brothers and sister, and they have to share it. When the sharing comes, that empathy develops. If they are just focusing on what they were growing up, then they will if they're sticking to narcissism. Why that is so important? The reason why it's so important, Islam is based on empathy. You cannot understand Islam if you don't understand empathy. Everything is empathy. The moment you become narcissism, you're going away from Islam. You want to get the best example? Look at Shaitan. Narcissism, full time, correct? Everything belongs to him. He can challenge Allah, right? This is total narcissism, right? So that's very important for you to understand the first 6 years of life. The kid has narcissism, but is moving into empathy. And that is a symbolic reasoning happening. Now, at that time, if you're using internet a lot, not learning properly, and not coming out of narcissism to empathy, then you have a problem, because down the line, when they're 6 to 12 years old, they have inductive reasoning. This is how the process of brain develops. You need to understand how the brain develops in a human body. As they are from 7 to 12, they have inductive reasoning. What is inductive reasoning? Inductive reasoning is based on observation. Now the child is looking at the observation only, and that is how they generalize the answer. Your answer or your conclusion is very generalized to the premise what the question was, correct? It's a very generalized information. So that is a very good way of doing it in a daily life, because you have to make a lot of decisions. So you're not mature enough. So that's a quick way of doing it. And that's a normal human process, that you have inductive reasoning from 7 to 12 years old. It's good to develop empathy at that time. So you understand, because you have not developed the frontal lobe yet. So you are using the generalized way of observation and in the form of inductive reasoning. But when you go to 13 and onwards, you start using deductive reasoning. Deductive reasoning is based on facts, your conclusion based on logical rules to the premise. And so you need all the correct facts and put together. That is deductive reasoning. That develops at the age of 13 and onwards. So you want to develop empathy by the age of 6 onward. The best way to develop is the kid should watch their parents or the caretaker. That is how they learn. That if the parents and the caretaker are taking their time and doing that, they learn from the observation, from hearing, seeing, and the behavior. It's implanted into their mind, and their habits, I use the word habit, will develop that way too. Now, you cannot blame all your habit on your parents. There's a lot of factors a person can do to learn it, but at least they have a good start of learning good habits, right? So it's very important to understand what they learn, how they learn when they're growing up, that they have inductive and deductive reasoning, but when the empathy develops. So you need to make sure that your kid develop empathy or start to develop empathy by the age of 6 onward. That is a very crucial time. Let's go to the next slide. Hopefully that's a very important slide to understand. Okay, so what internet does to you? One of the other thing which it does is affects the human sleep. Okay, now sleep is very important factor, because the reason why sleep is very important, because you have sleep is divided into non-REM and REM sleep. This is a sleep structure. So usually the normal time of sleep is 7 to 8 hours. This is the usual time, means for adult is 7 to 8 hours, according to American sleep medicine, correct? This is the usual time, 7 to 8 hours. So in the 7 to 8 hours, 25% of your sleep is in the REM cycle. REM cycle is the one where brain is very active, correct? Brain needs time to fix autocorrect you. And the RAM is the time when they are very active, correct? Fixing the issues in the brain. So you can see that the cycle is divided in stage 1, stage 2, stage 3, and stage 4, and then goes to RAM. So if you're sleeping less than 6 hours or less than 5 hours, your RAM is much lesser. than required. And this I'm talking about adult. The kids needs more sleep. So I just want you to understand that adult, the usual time is 7 to 8 hours. If you're sleeping less than 6 hours, or in fact less than 4 hours, they're saying that it increases the mortality of a person. So it's very important to understand that sleep is significantly important because it auto regulates you, correct? So there are different hormones are produced during sleep, correct? So you want to hit the sleep the proper amount with the proper quality of sleep. If you have the bigger quality and good quality of sleep, your cardiovascular system, your immune protective system, and your brain, the neuroprotective system, is very much intact and works better because there's a lot of things during sleep. The brain does it, or your heart does it, or immune system does it. So sleep is very essential for you. When you're using the devices or internet and you're not sleeping more and you have a blue light, it affects your sleep. So you're putting less hours in sleep process. That affects you, significantly affect you. And there are datas after datas in the last 20, 30 years showing that less amount of sleep is destructive to you. So you need to know the good quality of sleep and adequate amount of sleep, correct? So, and that is very important. So let's go to the next slide. This is how it's explained that when you see the light, the
I have a
uh,
question. I have
somebody
a
has a,
question.
go ahead.
So I'm going with the confusion that you are talking about just body, not the mind. How to address the thinking habits?
I will go. Yeah, I will explain to you. I will come back.
Okay.
Okay, so when you sleep, when you are awake, for instance, the all the light goes to suprachiasmatic nuclei, correct? And that actually suppress the melatonin, correct? So you remain active. So you basically are not getting enough sleep, and this is the pathway of the system how it works, correct? You need adequate amount of sleep to work, to correct your system. When your system is correct, you start thinking correctly. Your habits get better, correct? Let's go to the next slide. And this is explained the same pathway. The suprachiasmatic nucleus affects your neuroendocrine system, the cognition, mood, brain homeostasis, correct? It affects throughout your body. So you need an adequate amount of sleep and a quality of sleep, correct? Once you sleep better, you think better. When you think better, you can fix your problem better. So now you can think about it, what you're doing wrong, so you can have an educated, critical thinking behind that to fix it, right? This is just a slide showing that, okay? Let's go to the next slide. So these are explaining that hypocretin is produced when you're awake from the hypothalamus, and that keeps you awake. And melatonin is produced by pineal gland when you are sleeping. So you have a two rhythm, circadian rhythm and hemostatic drive. This is very active in your brain system. Very important to understand this system when you want to have a good sleep. So you need 7 to 8 hours of sleep to make sure that you learn things and work on your habits to fix the problem. Let's go to the next slide. Okay, next, so the question which was, I will answer that, go to the next one. Okay, so your question is how we can change our behavior, correct? From the behavior aspect, from the habit, how we change the behavior, correct? That's your question. So the question is, if you are concentrated on reward phenomena, correct? You're interested in internet, which helps your reward too much, and not understanding what it does to you, correct? And your akal is not making a decision because you are so much influenced by under the influence of your nafs, correct? It will make a huge difference because your akal is not helping you because you're under the influence of your nafs. And so that makes it difficult for your qalb or your mind to go in the correct direction. Now, how you change your habit, that's your question. You have to spend time on yourself to figure out what are your habits are. Are they constructive or are they destructive? That's your first process, correct? How much time you're spending and what are the habits. Once you identify that is not helpful, then you think about how I'm going to fix the problem, correct? Is it based on based on the Holy Quran and the Sirah? Yes or no? First of all, you have to answer that. If it's not, then why are you doing it? When it's not, and you're wasting your time on this, why is your reward phenomena is pushing you in that direction? Correct? You have to think about your biases, fallacies, and cognitive dissonance that is pushing your nerves to do that. Correct? So you need to fix your biases, fallacies, and cognitive dissonance as well as your ego conflicts. When you correct that, your nerves will fight against you because nerves enjoys what you are doing now, correct? And it does not want to cut down on the habit of what they are enjoying it, correct? So you need to go back to Quran and the Sirah to understand why Huzur Sallam used to spend most of the time doing good thing. Always wait for the namaz to happen. Why the Sahaba used to do that? Why the Sahaba don't waste time? The reason why they don't waste time because they knew that every second they will be asked in the next life. You have taken an oath, correct? In Alame Arwa. You have solemnly oath that I will follow the Quran, correct? And the Sirah in front of everybody, correct? You're giving the time, Allah is giving you time to test it. Okay, time is open for you. There's no limitation. But once the time is over, everything is over. You will not be given 1 second more. In fact, in the next life, you will beg Allah. We all will be begging Allah to send us back again so we can do something better. You need to understand that part. That's coming from the Quran, right? So these are the things you need to understand that we take it lightly, our habits, knowing that they are wrong because they give you pleasure. But don't understand, does it coincide with Quran and Sirah? If it does not coincide with Quran and Sirah, so then why are we doing it? Just to enjoy life? Well, if you could, that's why Allah has given you life. Do whatever you want because you will be accountable at the end of the time. And we don't know when the time is over. At least I don't know about myself, right? But I have the responsibility of teaching you the information. I keep myself in check or I question myself when I waste time. Nobody's above the law. We all waste time. But I can question myself when I'm wasting my time to think about that. Am I doing by the book, by the Quran and the Sirah? If I'm not, why I'm not doing it? Because that's what Allah will ask me. You were given time, you were given the thinking power, you have given the knowledge, you have given everything. What did you do? I'm accountable. On the day of judgment, I will not be sent back. So we need to fix our habit. Now, how are we going to fix the habit? We already know habits are in the unconscious mind as well as the conscious mind, correct? I explained to you before. So those unconscious mind, you have to think where in unconscious mind those habits are lying. You have to look at your reward phenomena, your punishment phenomena, and try to analyze, spend time on yourself. When you spend time on yourself, things will come up. If you don't spend time and keep yourself busy in doing other things, you will not find mistakes in you. I'm just telling you. You have to do due diligence and know Quran and Sirah. Hopefully, I answer your question. Anybody has any other questions?
So, so I'm asking about thinking habits, not the.
So what thinking habit are you asking?
I mean, when
Don't give me a
there is a
generalized
thought,
answer, a very specific question, so I can answer you.
so when we are trapped into our thoughts, like repeated loops, feedback loops, and these kind of thoughts, I want to escape from this habit, like thinking habit, not the uh, like mind habits, not the body habits.
Okay,
You
so
know,
what's the difference between thinking habit and mind habit?
the mind habit you're telling me stop using social media. It's the body you're talking about. Like when I want to stop about the loops, like thoughts that are disturbing thoughts in my mind.
Correct.
What about them?
So you have to analyze why the thought is coming, correct? First you have to analyze and what this thought is about, correct?
Yeah.
Give you example.
Yes.
If you're watching internet or something a program, something, I'm just giving hypothetical, correct? And you're enjoying it and you
Mm.
know that it is wasting your time, correct? But you're still doing it,
Yes.
correct? And you're
Yes.
enjoying it. Are you putting
Mm.
yourself accountable? That's the question. If you're not putting yourself accountable, you will keep on enjoying and keep on doing and don't realize how much time you have spent, correct?
Yes. Yes.
Okay. And then you
So
will keep on doing again and again because it become a habit, correct?
yes. So
So
so my,
you,
so my question is, when we are involved in these sort of things that you are talking about, we trapped into it when we are alone. Like solitude converts into loneliness. Like you can
correct,
understand what I'm trying to tell you.
correct. So you have identified which condition caused that, correct?
Yes.
Do you identify that Allah is watching you too? Yes or
Yes.
no?
Yes.
In the
But the
presence of
moment you
Allah, will you do it?
you can listen
I'm
to
just
my
asking a
argument.
question. If the Allah is in front of you, will you do it? It's a
And
yes
no,
or
I'm
no
not.
question. So
That's
that
why
is the
I
problem.
say
So the
that.
problem is we don't realize Allah is there. We take
So,
bypass the system. Who
but
cares
the
tomorrow is
moment,
exist? Correct?
but the mo- but the moment you say when it was unconscious, you don't realize what is happening. Like you,
Yes. So that's a good
huh?
question. So you don't realize, but you have a time that you're doing something and you identify that is not correct. Correct? That part you have realized it. Yes or
Yes.
no?
So I what I'm saying is it is very hard to escape from unconscious thoughts. Like we are involved into these habits like you are talking about. But when we are
Okay.
trapped into it, our unconscious thoughts hurts us. Like fears develops in us. Narcissism and these sort of things. I want you to address the cause, the real cause, actually.
Okay, so first I have to identify what is the cause individually, correct? You want to be on the top of the world, you want to have a fame, whatever, correct? I don't know what is the cause, correct? That's the
Okay.
that's the driving force, correct? Yes or no?
Yes.
Okay.
Yes.
Once you identify and you have labeled it, this is what causing me to do things without realizing, you have 5 prayers, correct?
Yes.
You break the system when you are doing the prayers, correct? Yes or
Yes.
no? Correct?
Yes.
Don't you try
Yes.
to think about it that what you did in the prayer before that, in that period of time, what you did, you can analyze it, correct? After the prayers, you
Mm.
can think about it, correct? So you have a time that I did this habit. I don't know why I did it, but I
Yes.
did it, correct? Because
Yes.
of I want to be on the top, correct? I can go through the system, which is not the right system, but who cares? I
So,
did it, correct?
so
Now you have
yes. Yes. When
identified your shortcoming because you did some mistake. You didn't identify the time when you were doing it, correct? But when you had the
yes.
thought, with the namaz and thought process to yourself, you identify I did it, correct? You already identify it. That's what we do in psychiatry. We try to identify when you put time to yourself and provoke
Yes.
yourself why this thought is coming. And when you
Yes.
start thinking, it will come up that I did that. I don't know why I did it, but I did it. I lied to a person
Yes.
to get this thing. correct? Because I thought it was the right thing. I didn't think about it,
Yes.
correct? Lie is a very common
Yes.
example, or backbiting is a common example, or whatever. Just name it, correct? I just did
Yes.
it. Once you identify, you
I wanna
have labeled it, correct? That I did that.
I
So in the
I wanna
next
say
namaz,
something.
okay,
I wanna say something. When I try to help myself or others, we are trapped into it like so deep that when I try to escape from that thought pattern, or want to structure my thoughts again, like I when I look back into my past, my conditioning, my mind conditioning, the content I consume, the games I have played, like the dysregulated system or cognitive system, I've trapped into
okay.
this whole
Let me
game.
answer your question. It's a good one. It's a good one. I'm glad you asked this question. Dekho, very simple to understand. First of all, Allah has given you more time, correct?
Yes,
Yes or no?
yes,
Whatever happened in the past, you have done it. You identified. Allah has given you more time, correct? This is
yes,
cognitive distortion that I cannot get out of it. This is a
mm,
pure cognitive distortion. Why?
mm,
Why Allah gave you the Quran? If everybody says I'm stuck with my habit, why should I read Quran? Because I'm stuck. Why
mm,
Allah said it's the book of hikmat for all of us, for future world, for all this every second, because you can come out of it, correct?
yes,
Then Huzur
yes,
Sallallahu at the time Huzur Sallallahu, there was a lot of people who did so many things wrong, correct? They were 20
yes,
years old, 30 years old, 40 years old. They were doing everything possible wrong, correct? Zamani
mm,
Jahliyat. Didn't they come
yes.
out of it? Did they conquer Roman and the Persian Empire at the same time?
So,
Did they give you this excuse, I cannot come out of it, correct?
so
It is
you're
our
you're you're
cognitive distortion.
yes, you're coming on my page like slowly, slowly. What I am trying to tell you is we are trapped into romanticism as nation. You look at our
Okay,
literature,
let me
poetry, and
let me
that
answer
sort of
this
things.
question.
That
This is not going to come in one day, 1 hour. I'm just telling you. But
yes,
identifying goes and then go forward in the right direction. Allah wants you that in the next prayer you have done less of those things, correct? Every day, if you're doing less, you're going in a better direction, correct? You're coming
yes,
out of it. If you do one less in the next prayer, you are going the right pathway. Yes or no?
yes.
So there
But the
you go.
moment
At
you
least you
say,
started it.
yeah,
Rather than
like,
saying I am trapped in it. Correct? This is called cognitive
yes,
distortion.
but
A human always find
yes,
cognitive distortion to get out of it. Correct?
yes.
That's why
You
Allah
know,
gave you Quran and Sirah.
yes, the moment you talk about salah, namaz, when we try to pray in front of Allah, then again shaitan comes and do these sort of things, remind us again these things, our past and these kind of
Okay,
mistakes.
let me answer your
Oh,
question on
you th
that one. That's a good one.
yes, yes,
So when we pray
complete.
namaz, are you trying to understand the meaning of this of the surat which you're reciting or no? Yes or
Yes,
no?
yes,
Okay, so you're understanding exactly what's you are reciting, correct?
yes, yes.
Okay, so you're understanding, but are you getting the depth of the meaning behind that, or you just saying it?
And mostly I'm just saying it,
Saying it, correct?
honestly speaking.
Were you proud of your prayer after the prayer was done?
No,
That tells you where you are. You go to your
yes.
boss and say, I did a shittiest job, just said it, but my paperwork was nothing, but I need raise.
You
What a
you you're taking my questions individually, but I'm speaking generally
So
because
generally,
I
I'm
have
talking to
I've
you that we read Quran or recite Quran not understanding what's the depth of it, correct? Once we understand the depth of it, And the other way to understand whether you're enjoying you're trying to get out of the salah is, did you enjoy the salah? Or are you looking for the next salah? And means in the proudness that may Allah give me the next salah so I can pray for it. Because there are a lot of people, I'm telling you, who are listening right now, will not listen, will not be doing the prayers. It has happened.
Actually, yes. Actually, I am presenting the case of my whole nation in front of you. Do you
Oh,
understand?
forget the home nation. First, correct your home. Nation is
Whole nation, sir.
okay, fine.
I said whole nation.
Everybody, if everybody correct their own home, the nation will improve, correct? But if we don't want to go to the nation when we have not corrected our own home, correct?
Yes,
Look at the
I have
example of
started.
Huzur Sasam.
Yes, sir.
We first correct ourselves. We have our
Yes,
shortcoming. Means I have shortcoming too. I'm not saying I'm above you, correct? But I
yeah,
have to be cognizant about it. If I'm doing something wrong, I'm responsible, correct? Because my last
yeah,
prayer is not coming back to me. So as yours. If you
yes,
understand that meaning, you will wait for the next prayer to pray better.
yes. Okay, at the end, as a technical person, what would you say if I want you to tell me how to unlock these cognitive locks that
Cognitive law.
my
Did you listen to my previous presentation of the all four of them?
no.
Okay, so you missed the basic bulk of information.
Oh,
Please do
okay,
listen to
thank
it.
you for okay,
It
thank you
means
for
you
your
joined
patience.
and you missed the whole 9 yards, right?
Thank you for your patience. I am so happy to talking
Okay,
to
you
you.
just listen to all the four. I go into
Okay,
minor detail.
okay,
That's why I told you all these sequence we are building up, correct?
yes,
Hopefully you will listen and then we can come with a question. Okay?
okay, I'll be there in the next session.
Sure. Jazakallah.
Jazakallah khair.
So please wait.
So
There
I
was you need to raise your hand. Muhammad Dilnawaz has been
Yes,
waiting.
thank
Please
thank you very
ask your
much.
question.
Yeah, thank you very much. Well, Assalamu alaikum, Dr. Najeeb.
Walaikum
I
salam.
believe you're doing good. Well, I just had have all of your sessions about this. To be honest, from the very second session of yours, I had a question, but yeah, that was covered later. So I have like two questions from you from two standards. Number one, like as you just talked about, like when your nerves is feeling pleasure and you are controlled by your nerves, obviously, so on that point, you are not the person actually who will be thinking about nafs mutmainna or super ego, because you are controlled by your nerves now. So my question is, this is a complete thought process, of the mind in the whole system, as you just explained here. So which is the best, that process actually you have to need to come out of that situation when your nerves is feeling pleasure, when you are doing any kind of sin, or which is actually giving pleasure to your nerves. So yeah, tell me please.
That's a good question. So remember, Allah has given you the fitrah, correct? When you're born, Allah has given the blueprint, correct? This is the right thing to do, correct? You're born with it. You took the oath and all those things. Now your nafs is enjoying the time and the pleasure, correct? You realize that your nafs is following something wrong which is not mentioned in the Quran or the Sirah, but you're enjoying it. Are you giving accountable for that? Is the question. If I'm accountable, I will fix myself. If I'm not accountable, I'm not going to fix myself. Correct? That's the first thing that will happen. I'm not accountable.
No,
I have
but how for that person actually who is not in that state to think about that, you should have to
you have to
start
go
this
into
whole
that state.
process.
So that's what I
Yeah.
said. When you read Quran, you do wuzu, correct?
Okay.
So same thing is your action means are you accountable or not, correct? If you say I'm not accountable, then you're not going to follow what is written in Quran and Sirah, correct? So how are you going to
Okay.
fix it when you're saying I'm not going to follow it, but fix me, correct? It's not going to happen. You have to accept, you have to take the shahada, correct? Become a Muslim. You
Okay.
cannot say, I'm not going to do Shahada, but I want to go to this, right? There's a requirement for everything. You go to university, you have a requirement, correct? To do the minor things, to do the admission and all those nine. Yeah, just don't show up for the class and say, I don't want to learn, but I don't know anything about it, correct? There is always a process, correct? We need to identify Allah has already told us. This is the process. You need to trust Allah. Trust is the most important concept. You need to understand you don't exist. Allah exists, correct? You don't have anything except what Allah says. That is something you have to put in your mind. If you don't, then there's a rebellious portion comes with the shaitan comes and say, no, you have time, you have couple of hours, you can do, nobody's watching, correct? Things like that. And your nuts was happy because it's enjoying it, correct? So you have to autocorrect yourself because you are accountable. You don't take the account, you get off. Like if you're working in the office and you're not accountable, then what the work, your productivity will be very poor, correct? You can do
Yeah.
anything. So there is the real life. Practical life is in your real life, you take accountability. But for your personal life or for other life, which is everything, you don't take accountability, but then you accept Allah will fix you. That's a
Like you have to,
cognitive
yeah.
distortion, correct?
Okay. So
It
your
means
super
Allah
ego have
said to
to
you, go ahead.
your super ego have to hit you first, you know, to get in that phase first, right?
Yeah, Allah has given you fitra. Allah has given you the Holy Quran, correct? And the Sirah. All the everything is given and given time, given knowledge, correct? You have been given akal to think about it. And if you think more, you will get hikmat. Do you correct more? Correct?
Okay, that's
When
great.
you
Well,
call,
here my lies the second question, to be honest. So I would like to
sure.
ask my second questions here on this point. Yeah, you just covered the previous part. That's great. Okay, so now a person actually who has recognized his, you know, like nafs mutmainna is there in him, you know, and now he have to stick with him. Obviously, you know, there are millions of thought processes and thoughts going on the back end in your mind, you know, in your whole system,
Correct.
as you know that. Yeah. So which is the best part of the mind, or his this whole process actually he have to stick himself, you know, to not to go back from this stage, you know.
You asked a wonderful question.
Yeah.
Wonderful question. And you know, look at the Sirah and the Sahaba. They used to do everything for their prayers. Do you realize that? They used
Yeah.
to almost do everything waiting for their prayers so they can meet the one who created them, so they can understand the significance of Allah and the hikmat from Allah. Right?
Yeah.
Once you understand that concept, that Allah is always with you, the angels are with you, correct? At the time of death, that will be taken away. You will start seeing angels, correct?
Yeah, you got
Angel
me.
of that you will see, I will see, right?
Yeah.
And
Perfect.
that thing is gone. Now you will see the other life, correct?
Yeah,
Our parents have
got you.
seen it, correct? So that's
Yeah.
not going away. That's a fact of life. Now, if you want not to think about it and sit on it, you can do whatever you want. But Allah has told you it's going to come back to you. It's better to realize now than later, correct? And
Okay.
Allah will
So
forgive you if you think in that direction, correct? Allah is
yeah.
always with you. But Allah means that's a shortcoming that the time of death comes, which we don't know. When it comes, we will not have time of forgiveness. Trust me. Allah has told you. It can
Okay,
happen
so
anytime. So
okay,
that's why you wait for the next namaz. So Allah, when the angel of death comes, he will know that he's waiting for the next namaz. From his mind, he's thinking towards going to meet Allah. So he's a Muslim. That's what you want to do. Not doing
perfect.
something wrong and realize my time came and I was not there. And how do I
Okay,
fix it?
last but not least, one more thing to ask shortly.
Sure.
So as you know, like, hikmah is actually a divine blessing of Allah, obviously. This is just a thing actually he gave on his own wish, or will. So sticking on this point, obviously, getting and explore yourself towards more, this hikmah. How can you, reach the real hikmah bar in yourself, in your mind,
Okay, that's one good one too. Remember, Hazrat Luqman Hakim got hikmat, correct?
Yeah,
To such a level that a whole chapter was like in Surah Luqman, correct?
yeah,
And Allah put what he advised to the kid in the Holy Quran, correct? Now
yep,
think about it. He was he was an average person, but he was a pious one. He strived to know about Allah, correct? The more you find in the nature of Allah's presence, Allah will give you more knowledge or more akal. When you reach to a higher level, Allah will give you hikmat too. Hikmat
perfect.
required akal. It's a prerequisite. And akal requires Islamic faith. That's the difference as compared to ilm. Ilm can be
Yeah,
anything. So you need to follow the akal as much as possible. So Allah will give you the hikmat blessing. It's all on you. It's all on me too. Correct? The more I get
yeah,
akal, I may get hikmat. Because Allah is waiting for me how higher I can go. Correct?
got you. Well, thank you very much, Dr. Najib. Thank you very
You're
much.
most welcome. Jazakallah.
Jazakallah khair. Yeah.
Any questions?
Yes, the next person who have the hand up, Aspa. Can you please unmute and ask the
Assalamualaikum.
question?
Walaikum salam.
So I want to ask you in context of you told that, and everybody of course talk about that one should have sleep from 7 to 8 hours. You know, normally science and medicine, everybody talk about that, and average sleep should be like this. So when we read about Surah Muzammil, and it says that arise to pray the night, except for a little, there are 7 to 8 verses which are talking about add more time, you can do less, we're gonna bless you with the Quran, and indeed we will cast upon you a heavy word. And then they say that indeed the hours of the nights are more effective for concurrence and more suitable for words. And then they say that because indeed for you by day is prolonged occupations, like you have so many things to do in the daytime. So add your like sacrifice your sleep and add your hours for worship and doing tafakkur. So when Quran is saying this to Anbiya, and we all know by the seerat of Nabi Kareem sallallahu alaihi wasallam, also from Sahaba, that they were sacrificing their sleep most of the time for the worship and the day into doing the action. So I can assume, and anybody can assume, that they were spending loads of time of working. We can assume that they wouldn't have 7 to 8 hours sleeps a day. So could we say that, or could we assume that they have more strength, or we can take it as that if you are uh, utilizing your time more doing in good, it becomes your strength mentally as well, instead of the weakness which people doing different tasks and the worldly task. So it becomes negative to the mind. But the things we are sacrificing our sleep, and we are not fulfilling our sleep, to that extent. So how you can, connect it in that context?
That's a very
Hopefully you
good
understand my
question.
question.
So that's a very good question, and let me answer your question. One is assumption and one is the facts, correct? So we need to know the facts, correct? So yes, you're right. They used to spend more time, but do you also know that there were times when they used to go to sleep after the Isha prayers, correct?
Yeah,
And when is the Isha prayers? 7 or 8 o'clock?
yeah,
So if you wake up at 3 o'clock, how many hours are there?
yeah. I can assume it. But what you say about like you are in UK, some would be in, in the surrounding area, the island or European areas where the
Okay, fine. So if you're going to Norway and all those things, you have to do what you have to do. I'm not going to that, but let's put it where this context is, correct?
yeah,
It was in Saudi Arabia, correct?
yeah,
So
yeah.
let's keep the context there, not to go
All
to
right.
North Pole and say where there's sunlight
I'm gonna
24 hours
connect
a
it
day
with
for
the next
6 months.
question actually.
That is going far, correct?
Yeah.
So let's put it where that took place. It was took place in Saudi Arabia, correct?
Yeah.
Arabian Peninsula. What time Isha was? 7 o'clock, 8 o'clock, correct? They used to go to sleep at that time, correct? That was after at night. They used to go to sleep. If you look into the detail about it, correct? They used to wake up early in the morning, so you can
Yeah.
wake up at 3. That's the best time because it's the ending portion of the night time and the beginning of the Fajr prayers. That is where you want to catch up, correct? But also
Mhm.
Allah said that don't spend too much. When Huzur Sassan was praying too much, Allah told him, you need to also sleep also. You cannot spend whole night praying and whole day preaching, correct? There's a
Mhm.
system. Now the burden is lot on Huzur Sassan because he was the prophet. For the human or the followers, the burden is much lesser, correct? So
Mhm.
in that scenario, you think in that direction. Then also you have to think about your individual medical needs also. If you have
Mhm.
diabetes, if you have hypertension, right?
Mhm.
And it make it worse because you're not sleeping, will you sleep less hour to make it worse and take more medication? You have memory problems and you sleep less, will you do that? Islam never says that if you have a medical issue, you still sleep less, correct? You take care of yourself. Islam means the religion is made easy for you, not difficult for you, correct? So let's use context correct based on that. If you look at the medical sleep medicine, it tells you in whole detail how many hours you need, what is the REM cycle, what happens during the REM cycle on your brain, the whole body, and how it's beneficial for you, right? Now, for a healthy person, it is good, but for somebody who has a medical issue, you need to take care of yourself. That's my viewpoint, but wallahu alam, Allah knows the best.
Yes, sir, you explained it very well. But the thing is, I'm keeping aside the medical person or the person who has some difficulties. Of course, they are free from enforcement and conditions. They have the relaxation. I'm talking about the healthy persons.
Okay,
So,
so
for example, I have given you an example, like in those area which I mentioned, and someone is willing to do and already implementing. But the thing is, uh, like how if the sleep gonna down, does it will affect them as well, who are
it's up to
utilizing
Allah
their
to
time?
decide. That is finally up to Allah, correct? I am not the one who's going to, but from
No,
medical
I'm asking about after
standpoint,
the
I'm
medical one.
telling you, this is what happens. That's all I'm saying.
Okay, so we can assume that they would have enough sleep, or they would have strength as well.
Yes, they will have, means there are times when people have so much strength and they can do whatever they want to, correct?
Mhm.
So I don't know the strength of Hazrat Ali.
Of
He took
course, it
away
will
the
be
whole
huge.
gate of Khaybar. Tell me how many men can do that?
Of course, the strength
Hazrat
from
Ali
people.
got hit by an arrow, and what was the advice given? Take the arrow out when he's in prayer. Can you find a person who can do that?
No, no doubt.
That is their prayer. And what our prayer? We will see everything around us except what we are praying. Correct?
Yeah.
So look at our cognitive dissonance. We preach something and do totally against our system. But then we say this is what is required. Look at ourselves. We need to fix ourselves. And that's my point of view. Nobody's above, but at least we need to look at ourselves.
And still you can understand that it's not a contradictory thing. I just want to understand the mechanism, because we all are talking about the mind. So if I leave the prophet and the sahaba, because they have more strength as per the iman and as per the body mechanism and so many things. But if we come toward the sophistic way, and the people who worships by heart, they give more time for worship, and still they are strengthful. Still they don't feel sleeplessness and the effect of mind, which a normal person who is not doing willingly, in the love of Allah. I think so. That what I want to ask you: the people who love Allah and they utilize their time and they sacrifice their sleep. I'm talking about the general person who have this strength of love for Allah. So what it makes them doing this? Like the goats. That's what I want to know. That if you are utilizing time in the goodness, does Allah bless you with the strength, or does
Why
Allah?
not? Allah give blessing to everybody. Allah wants to give blessing. He will make everything possible. Correct? Nobody can stop Allah. Correct?
Mm-hmm.
You sleep less hour and Allah want to bless you, Allah will bless you. Correct? But
Yeah.
what is normal? We are talking about normal.
Yeah, I know. I totally understand. I totally
So we
understand.
cannot put the extreme end to normal and expect they do it. Correct? Means
Yeah.
our prayer is so far behind from the normal, correct? And expect the highest level to do it. So that is a cognitive distortion.
Okay.
Correct?
Well,
Hopefully
I
I'm
want
making
to.
sense.
Well, I was adding this question because previously I was listening to a doctor who was a doctor of research from India to some USA, and she was telling about when people have trauma and things from the mind, and when they go for meditation and they give time to themselves meditating and different things. Although they have less sleep, but still they heals. They
Yeah,
automatically
Allah
heals.
can give blessing. Allah can give
Yeah.
blessing to
So
anyone.
what I assume that it is kind of that thing, because the people who worships in the nighttime, they are actually meditating by connecting themselves with God, and
Yeah,
God is
but
giving them strength. Maybe
yeah, but you
that is
have
the
to
main reason.
understand, are they following throughout the day the same sequence? Are they getting, upset on people, the people who are sleeping less? And sometimes you will see that they're praying a lot, but they're not to that level. They are not kind to other people. When they're
Yeah,
not
it could
kind
be.
and they snap on other people and say, I'm praying, and who the hell you are you missing the point of your prayers?
So you mean to say that sleep is necessary in any terms?
No, as long as you're not snapping on other people and not praying, I mean, not sleeping whole night and praying, and then in the daytime you're snapping on your other people, what are your prayers are? Correct?
Yeah.
Yeah, please
We
add
Sahaba
something,
never
Dr.
used to
Najeeb.
snap out or expect that being served to them. They used to clean their house. They used to work. Correct?
Yeah.
Are we doing that? No. If you're not doing, where's your prayer?
That's why
I
I
mean,
added that the people who are in love in Allah. So I believe that they have a construction process for a building process for their
so
mind, for their social
their
life.
their social life has to show that thing. Correct?
Yeah, that's what I'm saying. I
If the
already
social
said you
life
that I'm
is
not
not
talking about the
showing, then I
general
have a
people.
problem.
Yeah, whatever you said is no doubt accurate, but that's why I added a asterisk. The people who are especially in love of Allah and they are, they would be socially good, They couldn't love Allah until they are not socially good. They are not good to the people of Allah. And Allah said
Correct.
simply that I love my Prophet because he loved my people.
Correct.
The Prophet sallallahu alaihi wasallam. He been loved by Allah Ta'ala because he was loving his people. So the people who love Allah, they need to love his people. They need to be very good socially. So that's why I added an asterisk that I'm talking about those people who are general people, but they are into special fields. They are sacrificing their sleep and still they are better. So it's mean there is
Correct.
something which is not seen but working on behind.
Correct.
Yeah. Thank you so much, sir.
No, you must welcome. Can we end in 5 minutes?
Uh,
Or
can
how
I
many questions?
just one point to be added here? I need your approvals as well, if I can add here, please.
Sure.
Okay, so the last sister was saying, actually, I just want to second that thing with a litmus test. Like as we are talking about the building and training of our mental system and the uh, you know, transmittory system of our body, the neurosystem actually. So what if I say, like a person actually who train himself, like, and his cells and his body and his system according to its, not according to the requirement of the, like as you said, like obviously normally people sleep like 7 to 8 hours, but actually I also see those people like who sleep like 4 to 5 hours, but they are okay because this is a training system. They build their all the cells of the body and all the systems of the body in such way, like they control it. What do you say on this?
Well, if they have done it, good for them.
Yeah,
That's good. But
yeah,
usually you look at the majority of the people, correct?
yeah,
Your majority of people need this much amount of sleep, correct? That's fine. But if you can do lesser hour and be functional without any medical issue and very close to Allah, and if Allah has given you blessing, you should do it. Nobody's stopping you. You know, means we pray all night long when we need it, correct? So it's all up to you. Nobody's stopping you, but we just want to know what is normal so you can work on it and don't go do something which will affect you. That's all the point is.
yeah.
So do
Thank you very
what is
much.
best for you, and Allah will give the blessing, correct? But at
Yeah,
least you should be aware what is normal is.
thank you.
Anybody has any questions?
Sir, I have
I
a
think
quick
you have.
question.
Okay, you guys.
I
Sir, I
had
have
my
a
hand
quick
up. I wasn't
question.
given time. Brother Najib.
Yes, go ahead.
Quickly, just so because of turning everything online, from morning to night, everything we deal with, as the work, at work we're on the screen, all our own personal business is done online. It's difficult to get away from the internet. And I'm not talking about people spending time addicted to games or whatever. I'm just saying normal to all your businesses is online. And then when you want to come home, you want to listen to documentaries, even this program is online. So how can we switch off? And it's having an effect on our brain and our body biologically, everything. It's just the way of life these days. Everything is on the screen. So we can't get
Yes.
away from, looking at being on digital. It's a digital life. How can we address that issue?
Yeah, so professionally, it's every time everybody either on iPhone or on the website and things like that throughout the day. That cannot be changed, correct? That's fine. But personally, when you are off work, how much you are spending time on it, correct? That's very important. Are you spending time on your family members, your kids, and things like that, or you are just trying to overcome the frustration and spending time in front of the TV, correct? And that's where the important thing is, how much you're doing and how much you're sacrificing it, correct? So that is where the whole issues comes, that a lot of people use these devices to get out of that wall and spend so much time over there, correct? When you do that, the internet or through the phone and all those, the blue rays and all those things, that affects your sleep too, correct? And that is what the issues is, that you need to understand that it will change your behavior, the thinking process and all those things. So you should be aware of it, what is normal, what is not considered normal, correct? And then decide what's best for you.
But unfortunately, everything, if we can't, once there's the whole day, the number of hours you're at work, you're online. So that alone is a lot of time on the screen. Do you know what I mean?
Correct.
And then at home, you have to address your personal domestic issues, which is, again, everybody signpost you, go online, register here. Even if you're doing it for yourself or your family, the children are doing work online. It's just internet is being used for so many hours in the day. And it's not yours, even when you're spending time with your family or anything, you're watching something together or you're talking, there's very little time in the day. So, the balance is imbalance.
Okay, so you then at least, are you sleeping enough time? That's the most important thing, correct?
Well, no, because the best time of the sleep, the deep sleep, is when you have to get up again. You've done your fajr, you want to have an hour of sleep again.
So if you go early to sleep, then you can wake up early, correct?
As the daytime, is getting more, Isha is longer, and now here in UK, Fajr starts at 3:30, 3:45.
So
So,
you have to work with the system, correct?
there's okay. We talk about Saudi Arabia and how it was during the Prophet time.
Right.
There was a practice of sleeping during the daytime. We don't have that luxury. They used to have a nap during after Zohar time before Asr during the day. So it's just like the lifestyle. It's not that you're doing anything wrong, but it's just a busy lifestyle. Even when you want to learn, now we're sitting here listening to this session and we're still on the screen.
Yes, I understand, but this is a productive learning, correct?
Alhamdulillah,
Yes.
we're gaining. Alhamdulillah, we're gaining.
Yes.
And
We spend a lot of time non-productive learning, because we want to get out because we are frustrated and we want to watch movie or things like that, correct? Or TikTok and God knows whatever, correct?
well, I don't spend time on Facebook, no social media. This is the only
Social media, they go on and spend a lot of time, so you take away
I'm
time
talking
off
about
your sleep.
myself. I'm talking personally, where even if you want to sit and learn, gain some information, gain knowledge, learn whatever courses you're doing, or during the evening, it still means that you're on the screen and
Yes, I
digital.
understand, but we have to see what's best for us. And everybody has their own way. I just telling what's normal. Now, if it works out, good. If not, then you should look into it. That's my I'm just giving my opinion.
Okay, Jazakallah khair, Dr. Najeeb. I think we have taken a lot of your time. Thank you for all the information that you have given us. May Allah put barakah and may Allah give us the ability to absorb that information and practice it. Jazakallah khair and kaseera. Inshallah, we'll see everyone in the next session.
Thank you very much for coming. Jazakallah. And if I have said something incorrect, may Allah forgive me. Allah knows the best. Wallahu alam. Thank you for coming, and hopefully we'll see you next time. Jazakallah. Thank you for all of us. All of you.
Jazakallah khair.
Assalamu alaikum wa rahmatullah.